Hey y'all, it's your favorite host, Marcus Norman of the Gentleman Style Podcast Show. And today I have the unique pleasure and honor of interviewing this very profound, very hardworking woman. She is busy. CEO, physician, masters in business, wife, mom of two incredible children, and she is absolutely changing the absolute game. And she is here on the Gentleman Style Podcast stage, sharing insight, sharing wisdom, and giving back. I consider this a form of giving back to her community and giving back to the public to share her knowledge, share her health policy expertise, her entrepreneurship journey. Some work-life balance is in there on how she does it, the secret sauce, and how healthcare system is broken. And she's here on the Gentleman Style Podcast stage to help us live better quality lives and share her wisdom. I can't hold this woman back any further. Please help me welcome to the stage the incredible Miss Jessica, Dr. Jessica Edwards. Welcome, Doctor. How are you?
I am doing well, thank you. Thanks for having me on your podcast.
Absolutely. It's a true honor to host you. It's a true honor to have you here on the show today. I am humbled, and I always enjoy these conversations because you and so many women like you are leading the charge, and it needs to be discussed, right? It needs to be talked about. It needs to be admonished. It needs to be lifted up. And so when I invited you, I wasn't sure if you're going to accept, but I appreciate you taking the time to share and give back and share wisdom and insight. And so I want to start, Doctor, with a curveball, a softball pitch, and just kind of get to how you do it, because you have an incredible mind. You do many different things, but how do you balance your roles as CEO, physician, and a mother without compromising anything on the forefront? How do you do it? Can you help us do it and figure out how you do it?
It's a juggling act. I mean, I would say it's not easy. I think I've had to make the choices to be very intentional about respecting my family's time. So like yesterday, Sundays are usually my day off. So I didn't have anything planned and we just spent time as a family. And so I also try to be very cognizant of not working when my children and husband are home so that we can spend time together. And then also, I would say, there's always going to be compromise. I wish I could say oh, it's, perfect, because there's sometimes things come up and I do have to step away, from family time if it is, that kind of time. But I would say just in general, I think it's just prioritizing, what I want to be. I want to be first a God-fearing woman that has respect, values, all of that sort of stuff. And then next, I want to be an amazing wife. And then I want to be an amazing mom and then an amazing doctor. Not that those things vary in order of ranking due to their importance, but it's just what my priorities are. And so I feel like being the best version of myself is how I'm the best version of myself to everyone in my life.
Rock star. It's rock solid. I want to stay in the same lane, because this is good and this is what we need. I want to speak to first family and then transition to CEO, physician. One of the things nobody does this alone. Nobody can do what you do by yourself. So can you first start and describe how has your husband been a support system? What should ladies who are dating and actively dating and trying to find their love of their life and connect with the love of their life, what is it that your husband does to support you in all of the many facets of areas that you specialize in and work in, and what stands out? Can you speak to some of that, the family aspect first?
Yeah, so I would say on the family front, my husband has been with me since I was a third-year medical student. Actually, it was a second-year medical student. And so he's seen my entire journey. It's very interesting. My dad, who's also a doctor, didn't want me to marry him at the time because he's like, he doesn't have, his degree finished yet. And, he's not a doctor. He's not a lawyer. And I just went with who loved me. And so throughout my career, no matter, what job I took, no matter how hard residency was, how hard, business is, he's always been in my corner and he always shows up. And so, I always tell young women that are going into these careers, when you take off, for me, like when I wear scrubs and stuff like that, when you take that off, you take the stethoscope off, you are just you. And so if you bring that work home with you and you feel like you don't need anyone and you have to be this super, strong, independent person and you don't want any help for anything, you're making a disservice to yourself, because it's one thing to have a career, but I don't think there are enough conversations, particularly in our community, about the balance of power in relationships, right? Because, I would say I wouldn't be able to do what I do without my husband sacrificing and being selfless and saying, you know what, I'm going to, he handles my billing for me. He's my chief financial officer. And then he also is the most active parent with my kids because, I work a lot. And so my aunt told me this a long time ago. It's probably a couple years before I met my husband. And she said, honey, my Aunt Johnetta, she said, honey, you better go with who wants you. And so I think for a lot of women, they're missing out because the man that they think they want, I remember RIP to Kevin Samuels. I mean, he's controversial in his own way, but I remember like everybody's going after the same type of man and nobody wants to deal with a working class man. Nobody wants to deal, and so for me, it was great knowing that my husband, knew how to fix things around the house, knowing that he could, change my tire if it went flat. And, he just supports me in everything. And so looking back, 12 years later, I'm still 100% glad that I made that decision to stick with him because we're partners before anything else.
I love this. I love this. That was good. That was really good. This is the family part, right? That's coming out, right? In order to achieve, nobody gets out of this alive. No one achieves success by themselves. So you talking to that point that, hey, it's funny because I do the billing and coding for my fiance. So it's funny.
Oh my gosh.
So that's confirmation for me. Marcus, keep doing that billing no matter how much it sucks.
Keep doing it. Yep. You got to get an easy system. My husband knows how to do it in his sleep.
Absolutely. Absolutely. That's powerful. And so I want to transition now to business. You're a physician and CEO in the health tech industry. What is important to you, or what has supported you? Is it your team? Is it interviewing? Is it your sales? Is it marketing? Is it advertising? What is it that you can speak to the young lady business wise that has helped you succeed and grow in these business spaces? Because you're a woman, you're a Black woman, right? The obvious. You're a Black woman in business and dominating, right? And you're killing it. So can you give any advice or tips to the young lady watching you who says, I can't do it. I can't do what she does. Can you speak to that? What is it that you do in business, in the business space and entrepreneurial space that has helped you succeed today?
Well, I would say on the business front, what's funny is I actually enrolled my husband in community college when I started my residency in Jersey City, my intern year. We were on the phone, we were planning our wedding and stuff. And I was like, hey, I just need your social security number real quick for our marriage license and certificate. And next thing you know, he's like, why did I get something from Hudson County Community College? I said, oh, you can find something to do. I was like, I'm about to be working all these, hours and stuff like that. So he started, he got to start there. And then he ended up going to Rutgers Business School. And so throughout my journey of my career, once I got out of training, I got a chance to see in the real world just how distorted things are. I would say from a perspective, you have all of these non-clinical people that know how to do operations, but they don't understand the heart of medicine and they don't understand the intricacies of patient care. And so these people are, we like to call them suits, they're constantly saying, you got to see more patients. You got to do this. You need to add more billing. You got to do this. You got to, and it's just like, whoa. And then they're not providing you with any resources to do your job more efficiently. And so in the age of technology, there should be no reason that primary care doctors should be stressed out the way that they are. So I would say from a business perspective, he's the first person who kind of opened my eyes to the fact of there's no reason to work harder when you can work smarter. If there's technology you can use to lighten your load, use it. If you have to scale down, do it. He's like, if you have to, make sacrifices to make things work for your team and them to see like, hey, you're in the weeds with them, you're in the thick of it as well, then that's what you have to do. And so for me, I really just always try to treat those around me with respect. But I will say, and I say this all the time, my husband thinks it's kind of funny, but I tell him he's my covering. So he comes to all of my business meetings with me. So I'm not alone. And I feel like a lot of times when women are in these, situations, people know, especially, I'd say I wouldn't say like the modern woman in that sense in a negative way, but, if you look at the stats, there are a lot of women who are in these high level positions who are single, either due to time constraints or just not finding the right person. But I would say I bring my husband everywhere I go. So when I go to business meetings, I do that sort of stuff. And so I always tell women he's my covering. And so in seeing how he conducted business, I said I need more of these skills to be able to hopefully one day work for myself, which I'm graduating with my master's in business administration on this Friday. And so kind of following in his footsteps. But business is going to be what separates the sinkers from the swimmers, right? And so I think having that, one, being true to myself, second, also having my husband as my protection in these meetings where I'm dealing with people from all different walks of life, I think it says a lot. When we walk in there together, people are like, oh, I can't mess with her, just like, for instance, how Monique has her husband dealing with a lot of things with her. And, she's lost some opportunities because she has her husband, involved with that. But for me, I don't want any opportunity that my husband is not able to at least weigh in, look at, give me advice about. And so I would say the business acumen came from him, the desire to develop a business acumen. And it was probably the best thing that I ever did.
Love it. Love it. Love it. This is absolutely profound. And I love the fact that you touched on this and you expressed this and you showed my husband is my covering. And so he goes where I go, right? And how many celebrities would stay out of trouble? The Kobe Bryants of the world, right? The how many celebrities would stay out of trouble
Right.
if I'm going to a movie premiere and I'm filming whatever, iRobot, why not bring my family with me? Why not bring my wife with me? Why not bring my spouse with me? Because they're a part of me.
Correct.
And why even allow an opportunity for evil to set in? And
Correct.
so that really stuck out to me when you said that, and it's so true. You're a part of each other, and so the union between you two, and the willingness, right? I think we don't hear about enough of that. I think there are women that support men, right? But you got to drag them, and that's not what you want. That's not
Right.
what you. That's
Right.
not who you connected with.
Right.
So when you enrolled him in school, he was all for it. He wasn't, oh, why'd you do it? Let's cancel
Right.
it. No. He was willing. And that's the
Right.
key there, ladies. When you believe in a man, when you support a man, when you believe in someone, make sure they're willing to go with you, not
Correct.
just dragging them along. And that's
Totally. I remember my ex from college, he broke up with me the night before I was graduating because he was like, yeah, you're moving to Fort Worth, so I'm not coming with you. I said, okay, well, that's cool then. No problem.
that was someone else.
Yeah, this was back in college years ago. But I mean, it goes to show you like everybody can't go. And so I think that, I mean, of course I've had friends who I've known for forever, but my husband is my best friend. I talk to him if I'm like, hey, I'm thinking about this business strategy. I'm thinking about this. What are your thoughts on it? And I feel like as long as, as a couple, we are in sync, we can do whatever we want. Because, a lot of people talk about like, oh, you can't be in business with your partner. I don't think that's the case. I think a lot of people don't have the emotional intelligence to do that because they are so caught up on ego and I have to be this person and this is about me. The moment you take yourself out of the relationship and you say, how do I pour into my partner? Even if he's getting a little antsy, how do I say, you know what? Let's do something different. Let's, instead of going there to him, like, oh, you got an attitude, it doesn't work. And so I've learned that my value as a woman is by maintaining my composure, even if we're getting into it, and learning how to communicate what I need from him as far as support so that I can be as successful as possible.
That's significant. I that's significant because it really talks to emotional intelligence. Like you said, you have to have emotional intelligence to be with a woman like you. And so the person that previously missed dropped the ball, right, and said, I'm not going there, I'm not doing that. That's you, right? There's someone out there for you. Dr. Jessica Edwards is not it for you, right? And so fast forward, that is huge, and that's profound, and that's what's led you to be public speaking and speaking to women, young women, seeing you, right? They need to see you, and
Correct.
you're in front leading the charge, but it's not alone. It's
Correct.
not alone. It's not
Correct.
alone. There's a team behind you. There's a staff behind you, and there's family and love behind you every step of the way.
Yep.
Or you lose your mind.
You can't do it by yourself. Everybody who tries to do it by themselves, they don't do well. Like, I mean, you even look at people like, not to get into a hot topic, but like Diddy, he never married. Never had anybody to be like, it's time to go home.
That's true.
That's true. We're not having this party tonight. We're not doing it.
Or someone who says, I'm not even going. I'm not even going to be in attendance in the room because my wife is at home, my family's at home. Right. What could I possibly get from this party or this event if it's not networking, if it's not going to grow our health tech business, if it's not going to grow our practice, if it's not going to grow our family spiritually? Why do I need to be here?
Correct.
So 1,000%. Round of applause, Dr. Jessica Edwards, spilling the tea on Gentleman Style Podcast Show. Absolutely. Did I mention, y'all, a heart of pure gold? Dr. Jessica, Miss Edwards, I wanted to ask, what's one of the significant challenges that you faced as a woman in the health tech industry? Because technology is here. We were seeing it take over numerous facets, whether it be logistics and now healthcare and health and wellness and beauty. It's everywhere. What are some challenges you face in indoctrinating technology into the health tech space and you venturing into the health tech space?
I really did not have any intention of going back to working for myself. I had my daughter. It was a pretty rough pregnancy. When you get old, they call you old when she turned 35 and, geriatric pregnancy. I had a few complications. I had to go to the doctor every other week and all this sort of stuff. So I was like, maybe it'll be easier for me to just use the leadership skills that I've had, to run someone else's business. And I almost lost my mind because I feel like as a woman, we like to nurture. We like to take care of people. We like to take care of things. We like to handle things. Black women, we are that way. We like to solve problems. We like to fix challenges. And I would say the biggest challenge that I faced has been setting boundaries. And really kind of, and there's a quote my husband uses all the time. And I used to tell him, I was like, you're such a jerk for saying that, but he's right. Cameron actually says, he's interesting, just with his whole swag and stuff. But he says, when you meet me, you're down 30. So I'm waiting for you to show up to show me what you're about before you even get to a positive place with me where I can actually kind of like trust you. And so it's like putting in that work. And so I feel like, as a woman, a lot of times, I've seen this happen to my colleagues. It's happened to me. You let people slide with one thing. For instance, I had a situation where a previous boss that I was working, he would call me on Sundays. And I'm like, sir. And so I felt about it, but I never said anything to him. And so finally my husband was like, you've got to set a boundary. Like, this is not working well for you. He was like, because if you give people an inch, they're going to take a mile. And so I think the biggest challenge has been learning how to lead, obviously with grace, which I've always done, with integrity, but then also protecting myself from people overextending me, overusing me, using me for what they want to use me for, and then, getting rid of things. And so that's probably been my biggest challenge. And so, one of my new mantras now is that, I'm not necessarily a nice person, but I'm a good person. Like obviously I'm really nice. You can see that. But I'm saying, like, when it comes down to business, I make evidence-based objective decisions. Like, it doesn't matter who you are. If it's coming down to a business decision, We're not putting emotions in it, and we're just going to use the data to, kind of make a decision. And so, I think that is probably one of the biggest challenges that I think a lot of women face. And I think a lot of that career anxiety and work and microaggressions sometimes in the workplace and things like that contribute to a lot of women just pouring themselves into their career, because by the time you go to school, you get the degree, you take out the loans, you move to the new city, you feel like you're locked in. And so people go above and beyond trying to make things work. And a lot of times my husband will compare it to, working on a broke down car. You can fix it today, but that don't mean it's going to be working 2 days later.
Oh my gosh, this is absolutely good, and the example you reminded me of by saying, by sharing, saying, "Hey, I'm a good person, but I'm not gonna put the emotion when business is on the line." You reminded me of something LL Cool J said. He's like, "I'm a good man, but I'm not a nice man."
Right.
And the example he shared was, if he and his wife and his family are out in town and a thief comes and tries to snatch his wife's wallet, he's going to break that dude's arm, so he never snatches another wallet again. Now, him breaking the guy's arm makes him, he's not a nice man because he broke someone's arm, but he's a good man because he's protecting his wife and he's protecting his family. And hey, you tried to violate my wife and disrespect my family right in front of me. So he's a good man in that regard. So the same thing, I love how you incorporate it into everything you do, not just business, but you incorporate it in everything you do. I'm a good person, but I'm going to stand my ground in these areas and set these boundaries for y'all to not cross. Because there's me that's ultimately in charge here, and I have to make the decision. I'm going to make the tough call.
And you have to preserve yourself. Because I think what happens is a lot of women in business, they overextend themselves, and you can't pour from an empty cup. My mom has always told me that. And so if you're putting in all these long hours at this job and you're, I've got to be the top and they don't want me to make it, so I'm just going to keep, working hard. I don't know if today is a society for that, because I'm not sure what is on the other side of that. Like, you do all this stuff for this job, you get that promotion, you get the extra money. What does it mean if you don't have your free time? What does it mean if you don't have time to date, if you're single? What does it mean if you don't have time to spend with your kids? Your kids are in this big house, enjoying this house that you work so hard to build, but they don't have you. And so that's part of why I've rearranged my schedule to where I work around my kids. And, if I have a patient visit going on one of my kids, sometimes I work really late. Like, I see patients 8, 9, 10 o'clock at night, because sometimes it's when patients need to be seen. And all doctors' offices can't close at 5 o'clock and expect people to get care. And so if one of my kids come in, my patients are like, "Oh, there's the baby." Like, they know her name, and, they respect that. And I feel like that is a piece of telehealth that I feel like is very helpful for women doctors, because you don't have to choose anymore. You can set your own hours, work from home, you do your job, you do it well, you log off, and you have your family. That's why I'm in my little office now. I don't have my office in my room anymore, because I want to clearly separate what I'm supposed to be doing in each room.
Absolutely. You just fell into alignment with something I wanted to ask, and I need you to speak to women right now. Commonly, staying in the same lane, commonly women don't ask for promotions. They don't ask for pay raises, or they ask for it in the wrong way. Correct. And so, as a CEO, as a physician, as a businesswoman, what is it? Young entrepreneur, young go-getter female works for you. Mm-hmm. What should she present to you when asking for that pay increase? Because there are women who should advocate for their family time, but there's also women, those career-driven women, who they don't have a family, they're not dating right now, and so their primary focus is moving up in the organization. So as a CEO, maybe you've delegated this, but you're still involved, right? But what should a woman present when asking for that promotion, that pay raise from her employer? Can you speak to that young lady?
I think number one is results. Nobody wants to talk to anybody that's not delivering results. If you look at, what happened, in November, people's voting said they want results, and they effing around and finding out about these results. I don't know if everybody's happy about it, but and so when you look at things, I think in a transactional way of, okay, how much am I going to overextend myself? What are the things that the company needs that have not been addressed that I can do? When you solve a problem, when you address a pain point, you prove your value to a company. And I also think that it's a great time for a lot of young go-getter type women to not just rely on their job fully anymore. Like, this is not that type of society anymore, if you ask me. Like, I think it's good to have multiple, kind of revenue streams of income. It's good to, if you are going to put all your eggs in one basket, to make sure that you've got supportive people that you need to talk to who are recognizing your value, so that you don't have to have that conversation. But if you do end up having that conversation, coming to the conversation with data and stats and saying like, hey, these are my numbers for this year. This is what I've done. These are the number of people who I've onboarded. These are the people that I've done XYZ for, this, and that, blah, blah. You know what I'm saying? Like, that would make a huge difference as far as, what kind of value that you bring. And I also think that, really reading the room is important, because it's like, if you're in the middle of like a very difficult project with your boss and you're talking about something that might make or break the company, now is not the time to bring up you needing a promotion. Like, it, you know what I'm saying? And so I think that people, or women in general, need to take those like quarterly meetings and, bi-yearly meetings with their managers and employers very seriously. And if you work for someone that's not checking in with you at least, a few times a year to see how you're doing, what your progress is, where you're going, then I don't know if that's somewhere where you're going to be able to grow. So it's really reading the room, I think.
Absolutely. Facts. Hashtag facts. Mic drop, the whole nine. Because I'm so glad. I'm being selfish right now, y'all. Because as a woman, I think women need to hear that. And also, too, ladies, push back, right? If
Right.
you're doing your annual, semi-annual, quarterly check-ins to see how your progress going, and they give you a progress that's kind of like, it's like it's like word salad, right? They're just using a bunch of big words and not actually giving you any metrics to hit. Push back and say, I need some actual attainable metrics and goals that I can achieve. So I can say, okay, you want me to see these many clients, these many caseloads, or work on these certifications. Those are metrics that you can now hit, versus someone saying you're doing a great job, keep doing what you're doing. That means nothing to me. because the next conversation I'm going to have with you is, I'm asking for that promotion. And so if I have no metrics to achieve, and you're just telling me I'm doing a great job, keep doing what I'm doing, the only metric I really have is just time on the pond. And
And
time on the
just one
pond
word.
is
What
just
happens? All these companies all the time, they replace managers and people like that all the time, and it rocks people's worlds.
It does. It does. So huge, profound wisdom this episode. This is actually coming up, so this conversation is perfect timing, because I'm my CEO. I'm the CFO of my girlfriend's company. We're going to have this uncomfortable conversation here in a little bit with a practitioner of ours, and so not looking forward to it. But again, we're trying to make sure that we keep the conversation productive when
Correct.
we have that review with the therapist at a company, and just saying, listen, these are actual practical benchmarks that we've asked for, and you haven't met them, you haven't hit them, and we told you this from the beginning. We didn't hide anything, we weren't secretive of anything, and this is why we can't give you this. And that's kind of what it is. So huge, powerful. Doctor, I want to take a pivot moment and ask the question: what's your take on the role of healthcare, artificial intelligence, and the introduction of AI and chat GPT and technologies? And
Yes.
I'll start off with, to allow you time to, you probably have the answer, but I want to give my take. In mental health, that's a space my girlfriend and I work in.
Okay.
Introducing artificial intelligence to the healthcare industry, when you got people dealing with some of the most scariest things mentally, and some of the most scariest traumas and psycho analysis that we've done with these clients, they're dealing with something. And the introduction of artificial intelligence, where that AI could potentially deal with a client who's on the edge, who's about to jump, who's about to blow their brains out, is scary. What's your take on the role of AI in healthcare? Do you think it's a boom and it's absolutely necessary, or do you think it's a potential walking disaster, ethical dilemma coming up?
I would say I'll give you the the doctor answer and I'll give you the CEO answer.
That's fair.
That's fair, right? So I would say I'll give you the doctor answer first. The doctor answer is that AI has been incredible for me in general with my productivity, right? Like I'm able to utilize AI to help with find referrals for patients in areas where I'm not familiar with the specialist. I'm able to utilize AI for my charting so I can just focus on looking at the patient instead of worrying about typing a bunch of stuff. AI is also helpful as far as automations, as far as like when I sign off my note, we have like a setting that basically will, when I sign off the note, it'll notify my staff on like what follow-up items to do so they don't have to manually do it. Same thing with our phone answering service is AI. And so I would say from that perspective, it kind of helps to keep things, I would say lean. And it also gives, I think technology for African Americans, it's going to level the playing field. AI is going to make anything possible. I mean, there's really nothing you can't accomplish without AI, right? So for instance, a couple of months ago, my husband was working on one of our rental properties, and he was trying to find a plumber. And, plumbers will come out there and they'll just throw out a number. It's just so outrageous. You're like, never mind. Right. And he went on ChatGPT and was like, hey, I have this, and this going on in the bathroom, and I need this and this to be the outcome. Please tell me what supplies to use and how to do it. He fixed the plumbing himself. The other day, I was on, what was it? I think I was I was trying to figure out, actually a couple of weeks ago, before I even came across your podcast, I was looking up on ChatGPT. I was like, hey, like, what are the best websites to match with people for podcast interviews? And it gave me a list. I would have never known about this without it. So I think with the amount of information that's out there, I think it's going to be incredible with giving people the opportunity to find a lane. I would say from the business side, it's going to take away jobs. That's just, it's an unfortunate fact. It's going to take
That's a fact.
It's a fact. Like, I mean, when the computer can email people as soon as like they open the email and give them wow.
That replaced how many staff members. Now to that same breath, I push back on the biggest company that's the biggest industry that's in fear of artificial intelligence is logistics, trucking. They're fearful of automated cars and autonomous vehicles that can drive themselves. Well, I say to those individuals, and to the same breath, I say to the individuals who are fearful of losing jobs, what this means for you is you are going to have to get a new set of skills on top of what you already have. And so you're going to have to retrain. So instead of being fearful and saying, oh my God, this robot is going to drive trucks for me and replace my job. No, because we still need technicians. Correct. We still need someone to service that equipment, to service that robot, and act as a drone. Even a drone has a pilot. So you need to retrain yourself and get some new skills on top of the skills you already have.
Right.
And so same thing to what you just said, a computer that can send an email faster than I can even draft it is powerful, but there's someone that needs to service that system.
Correct.
And so retrain yourself. It doesn't mean I don't necessarily mean it correlates to loss of job. It will if you don't do anything. If you're not proactive.
You don't start learning the skills, if you don't start learning about what AI does, how you can utilize it to monetize things and stuff, I think that's a huge part. And even myself, like I started learning more about automations because I was like, man, this payroll is killing us. Like, whoa, I'm like, we got to find something else, right? And so with looking at how to utilize AI to, like I said, right now we have an AI auto attendant that answers the phones. You can see the entire conversation transcribed. So you know exactly what the patients need. So you see exactly what happens. You can send them a message after. I mean, it's streamlined things to the point of no return. And I think, learning those new skills and embracing technology, I think it's going to be a great opportunity for people to do well. Because I mean, even look at people like Kai Cenat. He's a streamer. He's on Twitch. Like, he literally sits around his friends all day and plays video games. People watch that.
Yeah.
He interviews people, they come up, and so I think figuring out how do I utilize AI to benefit myself, my family monetarily, what problem do I want to solve? I think it's open season.
It is, and we have to change, and we have to change with it. Just like what she said. So I don't want anyone to miss what she's saying. As a CEO of a company, as a physician, as a woman with an MBA, and even a wife, she has to relearn certain things. In her marriage is growing. Her marriage are evolving. Her children are changing. She has to evolve with them in order to stay relevant in being a caretaker and a mother to her family. And so in business, it's the same way. Even as a CEO, as high level as she is, she still has to learn. She still has to innovate. She still has to change. So if Dr. Edwards is willing to change, why you, the employee, won't? That's ridiculous.
Yeah.
That's absolutely ridiculous. Dr. Edwards, I knew this was going to be fine. I knew this was going to be epic. Doctor, I want you to first help us understand the definition of health equity, because you're the expert in this industry. So what is health equity, before I move on to my next question?
Yeah, so I think health equity just in general is a level playing field with outcomes. So where it's the opportunity for anybody, no matter where you live, no matter what your zip code is, no matter what your sexual orientation is, socioeconomic status, to basically create a level playing field. So if it's the ability to go to the doctor, if it's the ability to address things like health disparities, so things that affect us such as housing, education, and also training patients on how to advocate for themselves, I think is everything that encompasses health equity. And so it's like when you look at the whole DEI push in removing equity, everybody's just using the acronym DEI. And you're not thinking like, oh, this is diversity, equity, and inclusion. And so with equity in health, we've never had equity as a people. We have always been, I get patients all over the country every week who are like, oh my gosh, I'm so glad I found a doctor who looks like me. Oh my gosh, I'm so glad I found a doctor who listens, a doctor, that cares. And I think there wasn't a big push for that when I was coming through medical school, but now there's a big push with a lot of medical schools to start to accepting people that are not just, got their bachelor's and then go straight to medical school. They want people who have life experience. And so I believe in a lot of those situations, it makes you a better doctor to know what it's like to have not been listened to. And so when you look at a lot of the data about Black and brown doctors compared to our Caucasian counterparts, we're more likely and more willing to go to rural health clinics. We're more willing to go to federally qualified health centers. We're more willing to go and accept, Medicare and Medicaid and take care of people, even if it's, at a pay cut. And so I think that equity is one. I think, you can look at it on a systemic level and then you look at it at an individual level. I would say from a systemic level, we should really, as a country at this point, I've said this 90 million times, instead of having insurances like Medicare and Medicaid that marginalize people, like if a patient were to call a practice that was like in a beautiful suburb and say, hey, I have Medicaid, they're most likely not going to be seen because they don't accept Medicaid, right? Same thing with Medicare. Medicare is making cuts to physician payments, and we often know that a lot of patients who are geriatric, they have more needs, they have more concerns. You have a lot of economic things that you're dealing with now that they're, later in life. And so we've got to find a way to get health insurance to people that's not attached to employment. And I think that until we do that, we're never going to have health equity, because if a career woman, like we've been talking about, would quit her job, she won't have health insurance. Unless she starts her own company, hires somebody, now you're paying payroll taxes, you got to get loans, So I think until we have health equity with how we have health insurance, I don't think we're going to get any improvements in things.
So I want to make sure I hear you, understand you. The fix is this disconnecting between having health insurance and your employer. So maybe do it like countries outside of the United States who have free healthcare
Right.
and things like that. Is that the fix? Is that what you would
I would say
suggest?
that's the fix, but I would say it's not just saying, free healthcare for whatever you want, whenever you want, because we've seen countries like Canada, there's super long waits for things. People are being rationed. You don't want that. A company that has actually figured it out is Germany. They have basic health coverage for every single person who lives in their country. And if you want additional things, if you want plastic surgery insurance, you can buy that. If you probably want to get a GLP-1, you can buy that additional coverage. And they have health insurance brokers who sell supplemental plans. But everyone at a basic minimum has a certain amount of things covered. So imagine a healthcare system where you had unlimited primary care doctor visits that are covered. And maybe unless you had a reason, you're limited to a certain number of specialist visits, or you're limited to a certain number of ER visits, but you can see your primary care doctor as much as you want. If there was a way to have prescription drug coverage for all, generic medications covering cancer screenings, routine blood work, like there are ways that it can be done where it can benefit everyone. But I think for now, with all of the bureaucracy with Medicare and Medicaid, I get some of the argument about not necessarily cutting them, but restructuring them. Because when I was trying to get a network with Medicaid in Texas, it took me a year plus. I had to end up calling my representative and saying like, hey, they keep rejecting my application. I don't know what I'm doing wrong. And then like the next day I got approved. And I was like, okay. But they had me waiting for a year. So I had to deliver like 18 patients. I delivered their babies and I was not paid for a year.
Ooh.
And then when they would pay like $30 for an office visit.
That's not fair.
It's not fair.
That's not fair at all.
A lot of people don't understand that. And so they get irritated, they get angry. And that's not where the frustration lies. The frustration lies in the fact that the government is trying to cover these plans. They're outsourcing them to all of these third parties, and then the third parties are third party companies are millionaires, and they're but you got to think a business's responsibility is to their shareholders.
It's to their shareholders or stockholders, and so there lies another conflict, right? How do I prioritize patient care and making sure I'm providing quality care, right, to the fullest extent possible? Right. With and balance the budget and be able to pay bills tomorrow and be able to. Correct. So it turns into a whole nother conflict.
It does.
What I hear is transparency in our healthcare. We need more transparency in our healthcare system. And Germany, I'm glad that you said that, because the beauty of having your own podcast is you get to take notes. And so I'm taking notes. But also Mexico, when you walk into a doctor's office, it's right there like a McDonald's menu. It's it's in front of you. It's right there. X-rays cost this. You want your teeth clean? It costs this. This is how much you're going to pay. And it's transparent. It's in your face. There's no hidden secrets. There's no billing codes. I mean, I'm sure there's still billing codes and all of that if they use insurance, but it's in your face and you know how much it costs.
Correct. We tried that here, but it was just the No Surprise Bill Act. And hospitals do have to put their price on there, but oftentimes that doesn't include the cost of what the physician services are. So if you go in for a surgery at a hospital and you stay overnight for 2 or 3 days, they're charging you for that Tylenol.
Absolutely.
They're probably, and so the problem is that now with, all of the conversations about gutting Medicare, gutting Medicaid, the problem is that the hospitals are just going to raise their prices because more people are going to go to the ER. We have a law called EMTALA that doesn't allow you to turn anyone away who needs emergent care. So the hospitals are going to eat that cost. They're going to raise their prices. It's not solving any problems for anyone.
No.
Wow. And let's not talk about therapy and how there are some insurance plans that don't cover mental health. They want people to pay out of pocket for their therapy sessions. Like, mental health is so important. That should be something that's automatically included, and mental health professionals should be paid what they're worth. They're spending a lot of time with patients. I can get usually in and out within 15 to 20 minutes, and my patient feels like they have everything they need. When you're doing an actual therapy session, you're getting through trauma, you're getting through like this huge like background intake for patients. They should be compensated for that. And that's why you see so many doctors, mental health professionals, they're going the all cash route.
Yeah.
because they're like, I've got to get my money up front. I've got to take care of myself and my family. And so you see this move for like self-preservation. You see people doing like the membership services. You see people doing the direct primary care. But the problem is that with that cash only base, you're only going to get so many people.
Yeah, absolutely. Absolutely. Quote unquote. And yeah, you're right. That whole fiasco with TRICARE, right? One of the hard conversations that my clinical director and I had to have recently is TRICARE had all these, just like what Dr. Jessica Miss Edwards is saying, is like TRICARE transitioned like one of its regions to a different region. And all these healthcare providers who accepted military TRICARE didn't meet the criteria or didn't meet the timeline in switching over to the new system. And so it resulted in a lot of money. I don't have the exact figures, but it resulted in a lot of practitioners having to either pull money out of their savings, borrow loans to pay their practitioners and their staff because TRICARE is holding their money.
Oh,
Or had to turn
United has $5,000 worth of checks in the mail for me right now. And when I got the envelope, it was empty.
Right now for services you've provided
months ago, like
months
6
ago.
days ago.
So
that's got to change.
It has to. It has to. Oh my gosh. Oh my gosh. And thank you. I'm going to take that little quip and say that advocate speaking for the mental health practice. But
I get a lot of spillover because I'm primary care.
Yeah.
And so it's something that I've had to learn to get good at. And, you know, it's been a great experience for me to see patients, you know, quality of lives improve, but you have to be compensated for that time. And I think there also needs to be more insurance education, because I think we definitely have to have a conversation about why is someone paying $400, $500, $600, $700, however much money they have to pay every month, and then they still have to come out of pocket up until a certain amount.
True. But the insurance policy isn't even transparent enough. There's a lot of clients that do it. They come to us and they're like, okay, here's my insurance card. and I call and we do because I do the billing. I call and they're like, yeah, we'll pay 100% after they meet this $10,000 deductible.
Right, exactly. And it's like
that's not even feasible. That's not even logical.
You're basically paying more for the deductible than you are for the plan just to even use it. Like, that's criminal. You shouldn't.
Why am I paying you? Why am I paying you? Why am I paying you $200 and $250 a month to even keep this policy active when what I need right now is mental health services because my grandma died and my husband is suffering or I'm suffering from PTSD as a veteran? Could I go to the VA hospital? I absolutely can, but there's still a decent long wait list. And so what are my options?
Correct.
So OMG, y'all. Miss Edwards spilling the tea. You shared some unique perspective, and I love the perspective. What's another policy you would change that you believe would have a really long-lasting and powerful impact on health equity? Any other policies out there that you feel you would change that would make a significant improvement in health equity?
I think what would make a big impact with health equity is really looking at the intersection of health and life. Right? It's like if you look at, let's say, a 5-year-old child, they're in, kindergarten. Yes. And if you look at what zip code that this child is in, that's going to determine, they know by 3rd grade whether a child is going to graduate high school or potentially become a criminal, right? And when you look at a lot of the states that don't cover pre-K, 3K, 4K, all of that sort of stuff, a lot of these kids don't do as well, and they're not ready for school when they actually get there. Same thing with healthy eating. You shouldn't have to drive to the suburbs to get healthy food because you live in an area where they only have liquor stores and bodegas. Yeah. Right? And so I think it's looking at it as like an entire system. And it's not saying, oh, well, we're going to fix this one problem to address this issue. No, it's not that. It's looking into how do we do a better job of finding health-related issues in non-medical settings. Right? So it's like thinking about even with like women's health and looking at, domestic violence screenings and things like that. Like when I was, doing OB, I would always ask my patients that, like during their intake, I would ask that every single visit. There are some practices that do that. There are some practices that don't. But there are a lot of pregnant women who endure domestic violence. You think about those that endure domestic violence, the baby gets affected, the baby goes to NICU. That's $100, $200, $300, $400,000 bill, depending on how severe it is, right? And so I think if we have to decide, I think, if healthcare is a right or a privilege as a company, as a country.
Yeah.
And until we decide that, we're just going to keep doing this patchwork. Because even if you think about like the Affordable Care Act, I think it was a good step in the right direction. But being frank, so much stuff was stripped out of it. You can't even hardly find a PPO plan where you don't need a referral for everything on the marketplace. If you do find a plan like that, it's a small company that a lot of doctors don't even know about or don't take, or they have a very limited network. That shouldn't be the case.
Right.
And they're also looking at getting rid of the subsidies for those as well. So I think that's the bigger question, is deciding whether healthcare is a right or a privilege. And then from there, deciding how do we plug in health in non-health places to make a better, healthier country in general.
Absolutely. And so, oh my gosh, this is so good. It's so good. Dr. Edwards, I want to talk on what is a controversial issue when it comes to traditional business. And you have the best of both worlds. You're a CEO, you're a physician, so you're in business, but you're also in healthcare, in the tech space, and you're also a mom and a wife. And so one of the controversial things is pay gaps, gender pay gaps, right? Gender pay gaps between male and female. And you would think that there isn't any in the healthcare system, based on what Dr. Jessica Edwards broke down earlier, that, hey, you do a 30-minute session, or you do 15-minute, 20 sessions, here's what insurance will pay you. But there's still, surprisingly, pay gaps for gender in the healthcare space. What is your perspective on the gender pay gap in healthcare leadership roles? Do you think it's made up? Do you think it's FUPA, non-existent? Or do you think, hey, it still needs work? We still need to talk about this. We still need to bring this to the forefront of because it's still happening.
I think really the biggest piece of the pay gap is that there hasn't been accountability in operations offices to create that. One of the first companies that I worked for when I moved back to New York was One Medical, and they had pay equity. They paid everybody the same thing. And I took that with me no matter where I went. And so even with my company, I paid, if this was your role and this was your experience, this is how much you were paid. And I feel like that's the best way to do it, because when you have people making independent decisions and deciding, well, I'm going to pay this person this, or I'm going to pay this, or I'm not going to pay this person this, I'm going to give them a little bit less. That's when the problems happen. And so I think that there is a gender gap, a gender payroll gap. One, because there are a lot of people that don't ask for more. Two, it's always been sort of taboo to talk about what someone else makes. And some places even have where you can't discuss your pay. And then doctors also have things called non-compete clauses, where let's say you were to leave a job and you decide like, hey, I don't want to work at this clinic anymore, but my whole life and my whole family, so I want to go work at this place down the street. Sometimes you can't even do that. And so the cost to actually hire and retain and keep a physician is extremely expensive. Same thing with a nurse practitioner, PA. And so I think companies have to do a better job at having a diverse amount of people, whether it's race, gender, background, family structure, whatever, to actually weigh in on these decisions to make equitable choices.
Absolutely. Absolutely. And so pay people, absolutely. You are speaking to me. She's talking to me, y'all, because I'm constantly trying to always morally do the right thing. And that's hard in the healthcare space because there's so many external influences influencing that have a say or a guideline or a regulation that stipulate how I behave. And so I'll give you a prime example. One that was recently posed to me as now a CFO of a company is a client needs therapy. They send a requirement, they send in a request for mental health therapy. And so the gentleman is suffering from pornography. And of course, he picks one of my therapists who is attractive, right? And now she is in an uncomfortable space seeing a client that has an addiction to pornography and has an addiction with sexually visualizing women in a very negative way. And now now that conflict is, here's a client that needs therapy and needs services. I can't deny him services, right? He's requesting services, but my practitioner is uncomfortable with this gentleman because she's a female and she's an attractive female. She's a single female, and so it takes close monitoring and it takes a heavy heart, and it's a constant battle in this realm in the healthcare space to try and balance that moral compass with so many external regulations pushing back on you. It's hard. It is not easy. I think, Doctor, you are a true testament to leadership because it's really hard. It's really hard.
It's very challenging.
We just hired our first psych nurse practitioner, and we're looking forward to her because we think she has the heart that we're looking for in our practice, because she's going to open up a whole new avenue of services that she can help people with. But staying morally grounded is hard every day.
Every day. It's a conscious choice to be morally grounded.
Absolutely. This has been an epic conversation. I wish we had more time, but this woman got to run. She got things to do. She got many more lives to save and many more people to impact and many more people to encourage and lead and show forth, and her family to take time for. Doctor, you have shared so many nuggets this episode, so many gems, so many diamonds this episode. If you had one more nugget in the hat to share to that young girl whose back is against the wall, she doesn't know what to do, and she doesn't know if she can make it to tomorrow, what would you say to her right now who wants to take the step into entrepreneurship, into business, into even going to school to start her MBA? What would you say to her right now?
So there is a quote by Karen Civil. I'm trying to find it now because it really, really spoke to my life. And it said, I found it a couple of weeks ago, and it said, nobody claps for discipline. No one cheers for consistency. But one day, everyone will notice. Show up every day to fix your life. Do it alone, do it tired, do it scared, and just do it.
That was good. That was finger snaps, the whole thing. Doctor, how can my audience connect with you? How can we find you? The train has left the station, but it's not too late to get on board. How can we connect with what you're doing?
Yes. So I'm licensed in 26 states across the West Coast, East Coast, Midwest, and the South. So we have appointment availability 6 days a week, including evenings and weekends. And so they can connect with me at www.zaramedical.com. I'm also on LinkedIn under Jessica Edwards Shepherd. And yeah, I would love to connect. And I really appreciate the opportunity for today. It was so good to have these conversations. And I think this is how we continue to grow as individuals, is continuing to have fruitful conversations and showing up no matter what.
Absolutely. Thank you. Thank you for showing up. Like we end every show, we got to let this fabulous lady go. Like I said, she has many more lives to save and many more lives to impact. Like we end every show, take care of your friends, take care of your family, and always, always take care of business. This is Marcus, your favorite gentleman, and the superfragilisticexpialidocious, just Dr. Jessica Edwards, signing off. Love you guys. Bye.